Hi, everybody. I am so excited to have you here to join us with my favorite. Well, he's really not my favorite, maybe kind of. My brother from another mother, the Dr. Evan Gwilliam. And I could not imagine inviting anybody else to come talk to us about the new ABN form. I mean, I think we were kind of like trying to plan it a little late, but better late than never. And to have this conversation, and who better than to tell us than the smartest person I know. Do not let that go to your head, Evan. Anyway, many of y'all are familiar with him. I have him on here a couple of times a year. He has every certification known to man that I'm not even going to get into because there's, how many of them do you have now?
7, but who's counting?
Is it really only 7? Because it seems like longer, but he's trying to get those letters to wrap around his business cards because he's crazy, but I love him. So without further ado, I'm going to let Dr. Evan Gwilliam tell you why he is the man for this job.
So we're going to talk about the ABN today, and it was like, what is the sexiest topic, in chiropractic? So I got this ABN. I'll be honest with you, this is a form. It's a Medicare form. I mean, you say that to people and they just fall asleep. So this is not the most thrilling stuff, but it's important for you to know and understand, because if you get it messed up, it can cause great complications in your life. So you can see those certifications. Or wait, maybe there's more than, I got to count those. As some of them get old, I let them drop off and I replace them with something more meaningful. And I'm working on a new one right now. Regardless, I'm the clinical director for PayDC, which is a chiropractic EHR software. And if you are looking for EHR software, please reach out to me and I can talk to you about it. But we're here to talk about Medicare. So here's what I have planned for you. We're going to talk about the form and some things that have changed. There really aren't that many important changes. So I'm just going to review the basics and take you through what you need to remember so that you get it right. And so I want to make sure that you know what's in there and what you need to be aware of. Oops. Let's see. So are you doing the next slide for me, Christy? Here we go. So there's a list of my credentials. There's a picture of me in case you missed the one at the bottom of your screen. But I'm a certified coder. I'm a chiropractor, and I've been out all over the country for many years teaching compliance, documentation, and Medicare is a fun one. And so that's kind of where we are today. Next slide, please. So here is my reference material. And if you don't get enough from me today and you want more, go look up the Medicare Claims Processing Manual, Chapter 30. That's where you'll find the guidelines for the ABN form. In fact, an easy way to come across all this stuff is to just type in CMS ABN, and the first link that pops up on Google is the correct page on cms.gov, where you can get to the ABN form itself to download the most recent one, as well as to access the instructions, which are only 8 pages long. So it's not too terrible. I'm going to supplement some of this with the Medicare Learning Network SE1101, which is about medical necessity and stuff, because medical necessity plays into when you should and shouldn't use the ABN. So we're going to talk about that. And I just threw in this Code of Federal Regulations here, 49.2. Sometimes people are like, I can't keep up with all this. There's too much out there. Well, the provider is presumed to have knowledge of published Medicare coverage rules. So you can't claim that there's too much to learn and you ignored it when this ABN got changed and you didn't bother learning what had to happen. You have to know, if you are a participating provider or if you're enrolled with Medicare, you can't claim it's too much to keep track of. You have to stay on top of it. Okay. So next slide, please. So just a little bit of review here. I just want to start with the foundational concepts. Medicare is CMS. CMS is short for Centers for Medicare and Medicaid Services. I don't know why it's not CMMS, but that's what it is. Some of you old school folks will remember prior to 2001, it was called the Healthcare Finance Administration. And I can always tell who you are because you refer to the CMS 1500 form as the HCFA form. That means that you have probably been in this business prior to 2001 when that's what it was called. But they changed the name when they changed the name of the entity that published the form. Now, there are more than 61 million beneficiaries of Medicare, so it's a huge entity. You need to know what's going on with Medicare. The vast majority of those are elderly. And so 96% of the nation's elderly have some form of Medicare. Now, Medicare does set the standard for the health insurance industry. So what they say you need to know, but frankly, the ABN form is very unique to Medicare. So if you have someone coming in with Blue Cross or United Healthcare, there is no ABN, but the concept of the ABN still applies, which I'll explain in a minute. Okay, next slide. So again, just to review, Medicare is divided into 4 parts or types, and only Part B really matters to chiropractors and Part C. What we're sharing today with regards to ABN forms only applies to Part B, unless there is a Part C plan that has elected to use it. But typically they use their own policies and procedures, because Part C is when an insurance company takes over someone's Medicare and administers the benefits for them. So they're actually inside of a Blue Cross network or something like that, or AARP or something. So we're really only concerned about Part B and possibly C. If someone comes in with Part A, they don't have coverage for chiropractic and you don't need to worry about it. Part D is for prescription drug. Now, 2 other quick concepts to review is Medigap or supplemental. This is a policy that covers the copays and deductibles. So if the patient is responsible for 20% of the Medicare allowed amount, the Medigap may pick up that amount. So if someone has this, that's what a Medigap or supplemental policy does. However, some people have multiple coverages. And so if they have Medicare and a secondary, the secondary may actually cover services Medicare doesn't, which is particularly useful for chiropractic because Medicare only covers a few codes for chiropractic, and a secondary policy can be nice to help cover those other things. Okay, so that's just sort of a review, just to lay the foundation here. Next slide, please. So what is the ABN? Well, ABN is short for the Advanced Beneficiary Notice, which I think is a terrible name because it's very, it sounds very, what's the word I'm looking for? Complicated? I don't know. I think they could have come up with a more user-friendly name. This is only used for original Medicare fee-for-service, which is Part B Medicare. People have something that looks like the card that was on the screen a few moments ago, a true Medicare card, not a Medicare replacement policy, a Part C. And it's used when Medicare payment is expected to be denied. So it is a way for you as a provider to transfer potential financial liability to the Medicare beneficiary. So you provide a service, Medicare denies it. If you've properly completed the ABN form and provided it to that beneficiary, they are financially responsible, and Medicare is not. If you don't use this form for Medicare covered services, then the beneficiary is not responsible to pay you, and Medicare is not responsible to pay you if they have denied typically because of medical necessity. And that's it. You gave away free care, and that's all you have. So next slide, please. There's a couple of ideas that doctors get sometimes with the ABN, or something they heard once at a seminar back in 1996 or something. And I just want to cover a couple of concepts to make sure. I'll just throw them out right now. I want you to understand that if you don't enroll with Medicare, you can't use the ABN form and have people fill that out, Medicare beneficiaries fill it out, and then treat those patients. You have to enroll with Medicare in order to touch patients who have Medicare. That's just the rules with Medicare. You also can't use the ABN form to opt out of Medicare. Chiropractors can't opt out of Medicare and treat patients with Medicare cards on their own and work directly with the patient. In order to touch a patient who has a Medicare card, you have to enroll, and you can't use the ABN form to get around that. You also can't use the ABN form for anyone just in case. If you say, I never know if Medicare is going to pay, so I'm just going to have a routine in my office that I give the ABN form to every patient who comes through the door with Medicare, just in case Medicare doesn't pay. Medicare has in their guidelines that is not acceptable use of the form. It has to be specific to a situation where you can identify what's missing, why they won't pay. You also can't have a bunch of blank ABN forms and then have everybody sign them and then fill in the details later in the upper portion. That's not acceptable. You have to fill in the details, then have them signed. Okay, so there's a handful of things like that I've heard over the years, have been taught and gotten out there, and it's just, frankly, it's wrong. So we're going to take some time today to review the exact rules. A lot of what I have in here is like quotes from the guidelines. Here's what's happened. Let me share with you what has changed with Medicare with the ABN form. It is updated every 3 years. Okay, every 3 years we get a new form they're required to review it and get it reapproved. And it was time. The form expired back in March, and they took a little extra time, and they said, okay, here's the new form. We've got it. It expires in June 30th of 2023. At that time, they'll update it, maybe make some changes to it, maybe not, but they'll change the date at the bottom left corner that shows when it expires. If after 1/1/2021, January 1st of next year, you are not using this newer form that has that date in the bottom corner, then your ABN form is invalid. It has no weight. You can't charge patients for non-covered services. It's invalid. Now, the deadline to use the new form was 8/31/2020, which may be why we scheduled this webinar to occur now, because you were told you have to be using the new ABN form by the end of August. However, CMS has extended that to January because of COVID. But I was looking at Novitas, which is a Medicare contractor that covers like Massachusetts and New Jersey and such. And if you're in those regions, Novitas says it has to be in place by 8/31. They haven't changed it to reflect what CMS said. So you know what? After we're done today, if you're not using the new ABN form, just start using it. That's my advice. You don't have to wait until January. It's pretty simple. Don't use the old form that has the March 2020 date at the bottom left. Use the new one that has the 6/30. And if you don't have the form, just go to type again in Google, type in CMS ABN. It'll take you right to the page where you can download the official form in English, in Spanish, and in large font. Okay, and the instructions are there too. So my advice to you is to go ahead and just get it going right now. The next time you see a patient that needs to fill out the ABN, you use the newer form. But you do have until January 1st, according to CMS, maybe sooner, depending on who else you might ask. So what changed? The wording was changed around in the instructions. So the instructions, they moved some stuff around. They made things clear, like creating bullet lists of things. They list out provider types who are considered notifiers. So for ABN purposes, a notifier is the provider who gives the ABN to the patient. And they made a bullet list. They added instructions about how to customize the form. There's a couple of places where you're allowed to customize it. And they said you're not allowed to use a Medicare beneficiary's identifying number on the form. So they made that clear because that's a newer number that wasn't around the last time they had instructions. And then we'll look through each of these, but there was some instructions in the boxes, in the blanks on the form. They changed a couple things around in a few places. Nothing huge, nothing very dramatic, but I'll show you a few things. And then they added some special instructions about dual coverage situations, patients with Medicare and Medicaid, which for chiropractors, for most of you, isn't going to be that important because in most cases, Medicaid doesn't cover chiropractic around the country. But if it does cover for you, I'm going to give you a little bit of introduction into that. And then I'm going to point you back to the instructions because it gets a little more complicated. And I believe it doesn't apply to the vast majority of you patients coming with Medicare and Medicaid where chiropractic is covered. So next slide, please. We're going to take a little bit of time. And I apologize. This is a little boring, but I want you to understand the rules here. We're going to go through the ABN rules. You can find these in the Claims Processing Manual, Chapter 30, Section 30. Okay. By definition, the ABN is proof that the beneficiary knows a service was going to be denied, but that passes liability on to them for disallowed claims. Yeah, so that's your proof. And without it, you cannot collect from a patient for denied services. When you provide a service that you know doesn't meet locally acceptable standards of practice, and in the instructions, they have a couple paragraphs that explain what acceptable standards of practice are, but it's basically care that's peer-reviewed, common in the scope of licensure, that kind of thing. If you furnish services that isn't that, so let's say you're doing some sort of experimental thing with, light waves and incense and some fancy electronic equipment with, different impulses, whatever. You're doing something that's not typically normal, acceptable standard of practice, but you want to do it and it helps patients. Then that means that that Medicare payment should be denied and you should provide the ABN, if you're modifying your adjustments or whatever. Next slide, please. So that was Section 30 of the ABN rules. Section 40 dives in a little deeper, okay? So Medicare says, look, this written notice, the ABN, allows the beneficiary to make an informed decision about whether or not to receive the service. That is the purpose of it. It lets them be informed. And it helps them better participate in their own healthcare treatment decisions. So it's a nice, noble purpose for this form. We are told in the instructions that it must be furnished to the beneficiary before the service is furnished, far enough in advance for them to make an informed decision. And if you give it to them too close to when the service is rendered or afterwards, it may be considered invalid. Okay, the patients need to be able to make an informed decision. You also can't explain to them, look, the reason I'm giving you this form is because it's medically unnecessary. That's not enough. You have to explain why it's medically unnecessary. Explain that, because it's considered maintenance care, for example, or it's just it's beyond what Medicare covers for whatever reason. And so make sure that these criteria are met. Next slide. So again, in section 40, and I apologize, one of the rules of PowerPoint is to, keep it to 6 bullet points or 6 words and so on. This slide is way too busy, but I just copied and pasted it straight from the official guidelines here because I needed to make sure you understood. I underlined the key word, though, in each bullet. If you do an ABN, a written notice, it's not acceptable if it's unreadable or incomprehensible, and that's the first bullet there. So if you give it to somebody and the patient doesn't understand it, even if you believe others could understand it, it's invalid. If you give it during an emergency and the patient's under duress, or you coerce them into signing it, or you mislead them somehow, it's not valid, okay? If it's given routinely. So again, some chiros say, well, I just always give the ABN to every Medicare patient. That way I'm covered in case Medicare doesn't pay, and then I can get the patient to pay me. That's not acceptable. It can't be routinely given to all beneficiaries that you give services to. It needs to be given in those circumstances where you've identified something that shows why that service may not be covered. And you can't say, well, there's a chance it may not pay, and that's the reason I'm giving you the form, because there's always a chance. They said that's not an acceptable reason either, and it can't be given more than a year ahead of when the service was given. So ABNs are valid for a year at a time from when they're signed, assuming nothing else changes, okay? Next slide. So a little bit more here from section 40 of the Claims Processing Manual, chapter 30. The written notice should be delivered in person to the beneficiary. So emailing it is generally not acceptable, and delivering it is your responsibility. You are the notifier. The provider is what's called a notifier in these guidelines. Now, it must be prepared with an original and at least 2 copies. In the guidelines, it does clarify and say you can print the form, have it physically signed, then scan it into your system, and then give that original to the patient, and that should suffice. So that's one way you can do it, where you don't have to make photocopies and file a bunch of stuff. But it needs to be given to the beneficiary right after they sign it. Okay. So this is all straight from the horse's mouth. These are those official rules with a few changes since the last time they updated them. Next slide. Now, in section 50, which is the next section in these guidelines, it says that these are only for patients who are enrolled in the Medicare Fee-for-Service program, which means it's for Part B. It's not used for items or services provided under Medicare Advantage plans, which is Medicare Part C. That would be something coming in with, a Blue Cross plan through Medicare that's taking over their Medicare or something like that. Now, I believe, and I'm not certain on this, that Blue Cross could say, actually, yeah, we do want to use Medicare's ABN form, and they can make that decision, but it's specifically for patients with the official Medicare card, the Part B Medicare card, okay? And it applies to them only. Now, we have an option for something called a voluntary ABN, and this is a very important thing for you to understand, so I will explain. The ABN is mandatory if the service is covered by Medicare. And if the service is not covered by Medicare, no matter what, it's excluded all the time, then you don't have to offer an ABN to explain that the Medicare is not going to pay, because it's an excluded service. They'll never pay it. But you can give the patient a voluntary ABN in that case. It's a courtesy to the beneficiary, just letting them know there's probably a financial obligation. The patient's going to have a financial obligation whether they fill out the ABN or not for non-covered services. So the reason I recommend you do not use an ABN voluntarily for non-covered services is because the guidelines say that if it's used voluntarily, the beneficiary should not be asked to choose one of the option boxes, which we're going to talk about, or sign the notice. And it bothers me that I would tell the patient, look, these services may be your responsibility. If I'm going to do ultrasound, you're going to have to pay for that out of pocket. But I'm not going to have him sign the form because I'm instructed not to. And that bugs me. So I would suggest that instead of using the ABN for voluntary purposes for non-covered services, you create your own form, something like a notice of patient liability with much friendlier language. And you can say, hey, in our office, we bill Medicare for you, but it only covers CMT services, and we provide all these other ones, and here's the price for them. In fact, if you're a member of ChiroHealthUSA, then here's the price you can get, the discount you can get for that, and it's a no-brainer, so join ChiroHealthUSA right now or sign up, and we'll get you going. And so this is a great way to introduce patients to their discount medical plan as well, to ChiroHealthUSA. So next slide, please, Christy. So this is the difference. You must issue the ABN. It's mandatory if you are providing covered services and you believe there's good reason Medicare will not pay for them. And the only things that Medicare covers for chiropractors is 9940, 9941, and 9942, which is chiropractic manipulative treatment. If you believe Medicare won't cover it probably because it's maintenance, or you're not providing the care due to medical necessity, you have some other reason to give it, then that's when you have to do the ABN. You could use a voluntary ABN for anything else you provide in your office that's statutorily excluded, which is everything else chiropractors do, like evaluation management codes, radiography, modalities, therapies, durable medical equipment. Those are all things that are statutorily excluded. You are not required to give the patient an ABN that includes those things because Medicare doesn't have no jurisdiction over them. They're just between you and the patient, and you can still collect for them. What you can't collect for is chiropractic manipulative treatment that Medicare denies, unless the patient has signed the ABN and agreed. Okay, I think I have a little bit more on this a little bit later. So next slide, please. So back to section 50 of the Claims Processing Manual, chapter 30, it says there that ABN should be retained for 5 years from completion of the delivery of care. So again, thinking of a medical model, if someone got their arm chopped off and sewn back on, you eventually stop treating for that. Chiropractic care, patients come back 6 months later, a year later, and so the question is, when is the completion of delivery of care? Well, it's I guess you could say it's never. Just keep this documents forever. Scan them somewhere so you don't have to have a big pile of paper. It's a good idea to just keep good records. Okay. The ABN remains effective for up to 1 year. So after a year, you have to get a new one, and it can be for the same reasons. You're still continuing to do maintenance care, but it's only good for a year. You can't retroactively date an ABN. You can't treat a patient for 3 months and then go, oops, that's probably maintenance care. Here, sign this real quick and backdate it. It doesn't work that way. It has to be provided to the patient before the services are rendered for it to be valid. Okay. And then a common question that we get is, well, when I switch from regular Medicare, where I'm billing them, say $30, I bill that to Medicare and that's what they pay. What about when I switch to maintenance or wellness care? Can I collect my regular fee, which is $50 instead of the 30? And according to the official guidelines, it says providers are permitted to charge and collect the usual and customary fees. Therefore, funds collected are not limited by Medicare allowed amounts. So some providers choose to say, well, if Medicare only pays me 30, then when I switch to wellness care, I'm just going to bill these senior citizens 30, and that's one way to handle it. The best way to handle it, of course, is to say to the patients, look, we're now switching to care that's not covered by Medicare. I advise you to get on ChiroHealthUSA, and we'll give you these fees. And you can give me a ChiroHealthUSA fee schedule, and that's the best way to do it. But the guidelines say you could jump up to your full fee if you wish. And it's straight from Chapter 30, Section 50 of the Claims Processing Manual. Okay. Next slide. All right. So I want to talk to you about, I have 2 more topics to cover. One, I want to go through the form just to make sure you know what to fill out. Some of the instructions changed a little bit about how to fill out an ABN form. It's not that hard though. And again, you can get the official instructions without much trouble just Googling CMS ABN. And then the last thing we'll talk about is medical necessity, because that is what determines when you need to use this form. So I'm going to talk to you a bit about that from Medicare's perspective for the last portion here. So let's go through the form. There are 10 blanks for completing the ABN or Advanced Beneficiary Notice. They are labeled A through J. Blanks A through F and blank H can be completed ahead of time, but the others, which is the signature and the date, have to be filled out right then and there. There's actually a whole bunch of instructions about how it has to be legible. Entries can be handwritten or typed, but they say you really need to use 12-point font. And they say, but maybe 10-point if you have to, but really try to go to 12. So there's a whole thing about making sure it's readable. Okay. So next slide, please. So this is the top of the ABN form, and this is the new one, although this, I believe, is identical to what the last one looked like, this portion of the form anyway. So this is the top third, and what I'm going to do is take you through each of those blanks. We have 4 of them here, A, B, C, and D. I'm sorry, 6 of them, A, B, C, D, E, and F. And we'll go through each of those, and then I'm going to move down to the middle of the form and talk about the blanks on there. Make sure you know how to fill those out, and we'll get to the bottom. And so you're really clear. And I'll show you a filled out form for typical chiropractic maintenance care so you can see what I think it should look like. Okay. So first we're talking about the blank A, which is the notifier. The notifier is you, the provider. So you are required on an ABN form to put your name, address, and telephone number at the top of this notice. The instructions say you don't have to write them in or type them in. You could just slap a stamp on there or a sticker or a label or have your logo printed on a form like this that includes that information, and that's acceptable. Okay, as long as we know who you are, where you are, and what your contact info is. Okay, next slide, please. The next blank is B, the patient name. The rules there around the patient name says that you should enter the first and last name of the beneficiary, include a middle initial if it's on their Medicare card. If the name is misspelled, but they can still tell who it is, the instructions say you'll be okay, but try to get it right. So be as thorough as you can there, and include the middle initial if it's included on their actual card. Okay, the next one, the next slide, please. Blank C is the identification number. This is for internal purposes. This is not the Medicare identifier. It's not the HICN, and frankly, I'm not even sure what those are, but the Medicare beneficiary identifiers that have been given to Medicare patients. You're not allowed to put that in this space. You can't put social security numbers, which is what we used to use way back when. This is for you if you're in your office, keep track of patients and have patient ID numbers of some sort or a file number or something. This is a space reserved for you to be able to do that. You can leave this blank if you wish. Okay, it's not required, but it may be helpful for you as you file these away to help you track, who your patients are. Okay, next slide, please. So blank D is important because there's actually 7 of them on the form. We only see the top of the form right now, so we only see 3 of them, but there's 4 more blanks labeled as D. Okay, this is where you need to list the specific service that you believe is not going to be covered, that you're providing. So you can read that paragraph. It says, if Medicare doesn't pay for this service, let's say it's a chiropractic manipulation, you may have to pay. Medicare does not pay for everything, even some care that you or your healthcare provider have good reason to think you need. We expect Medicare to not pay for the chiropractic manipulation below. And then the big box for D, you put in there, chiropractic manipulation for maintenance care to make it even more clear. Okay. That's the service that you're providing that may not be covered. If it's a repetitive type service, such as chiropractic manipulation, or like in a physical therapy setting where they're coming back for multiple services and a physical therapist is doing the ABN form, you should also specify the frequency and duration of the service to make it clear to the patient it's not just once, if it's going to be once a month or what have you, so they understand the total cost more clearly. And again, all 7 of the D fields have to be filled out. The big box on the screen is where you can put a little bit more detail in there. I don't know if this will apply much to chiropractic, but they say that you don't, like if you're doing supplies for something, you can just say supplies for something here for other specialties. You don't have to list every single item. And so again, I think for the vast majority of us, this is going to say chiropractic manipulative treatment because Medicare doesn't pay for anything else that chiropractors provide. So you'd have no other reason to give the ABN because it's only mandatory when you're doing covered services. Okay. If you want to do it voluntarily, you can, and you can list the services here, things like x-rays and exams, and use this for that purpose. But remember, if you do it voluntarily, you're not allowed to have the patient sign it or choose one of the options. Okay. Which is why I believe you should just make up your own form, which is totally acceptable, and have the patient sign it so you have record that they acknowledge that those services would be provided to them and they'd have to pay for them, and they understand that. Okay. Next screen, please. So blank E is the reason. And the instructions say this must be beneficiary-friendly language. And they have to explain why they believe the services listed in column in blank D aren't going to be covered. And so I think a great way to say this is Medicare doesn't pay for chiropractic manipulation that is considered maintenance care. And so we're going to talk more about what is maintenance care and what isn't. You guys may have heard it before, but it's still important for us to review because I'm working on an audit right now. It's not Medicare related. The provider received an audit report and basically said, look, you have to give us back $40,000. And a lot of the payback is due to the fact that the reviewer felt that a lot of the care was maintenance care, and that payer doesn't pay for maintenance care like Medicare doesn't. $40,000. It's been reduced to $20,000 already due to some fighting. We're going to try to go even further and see if we can find anything in his record that shows that it wasn't maintenance care. Okay. So in this case, of course, with ABN, we're trying to make it so that you can get the patient to pay you for the care, and you're allowed to collect from them. If you don't have this form filled out, you can't collect from them or from Medicare, so you just have to give the care for free. Okay. So next slide, please. So F is the blank for the estimated cost. Okay. You have to complete blank F to make sure the patient has all the information they need to make an informed decision about whether or not they should receive the services that are probably not going to be covered. So you have to put in how much it is. And if it's, $30 or $50 per visit, then you put that in there. The rules say that it has to be within 25% of the actual cost or $100, whichever is bigger. So you can't just throw out some random number that's way off. You have to pick one that's close, okay? And try to be reasonable there. So next slide, which is going to move us down to the middle of the ABN form. So now we're looking at the middle of the form. You'll notice there that it has some instructions that says what you need to do now. So this is instructions to the patient, the beneficiary. It says read the notice so you can make an informed decision about your care, ask any questions you may have after you finish reading, and choose one of the options below about whether or not you want to receive the D, which is the service listed above, which in this case will be chiropractic manipulation. And it says no. If you choose option 1 or 2, we might help you to use other insurance you might have, but Medicare can't require us to do this. So this is, again, the office talking. So let's look at blank G that has 3 options. And within those, you have to fill in the D there for the service that was listed above. Option 1 is kind of long, and it allows the beneficiary to receive the service at the time, but it requires a notifier to submit the claim to Medicare. Okay, so this is somebody saying, look, I get you're telling me that Medicare won't pay, and I understand that I'm on the hook to pay, but I want you to bill Medicare just in case. And if Medicare denies, then I have to pay you. And if they don't deny, then you have to refund me, if Medicare ends up paying. You can appeal and fight that in this case because a claim has been submitted. Okay, that's the advantage of option 1. However, you and I and everybody else knows that maintenance care is not covered. And if you really believe what you're providing is maintenance care, Medicare is going to deny. So hopefully the patient picks option 2 instead. Oh, before I go there, though, you need to know that option 1 is one of the places in the instructions where it says you can modify this. You can cross certain things out in there. This is particularly important for those who have dual enrollment with Medicare and Medicaid. Otherwise, the claim won't be adjudicated properly. This allows the claim to be passed on to that other payer, Medicaid in this case. And there's more to that story. There's actually a whole Medicare Learning Network article on that topic. You can find it through the instructions if you just go to that, again, CMS ABN, and one of the links takes you to that to explain. If those of you are in that circumstance, there's more to that story that I'm not going to dive into. So next slide, please, and let's talk about option 2. So if the patient selects option 2, you do next slide, please. Option 2 says, look, I'm going to receive the service, but I don't want you to bill Medicare because I understand they're not paying. I get it. It's all on me. And since you're not billing them, I can't appeal. So can you go to the next slide? Let me make sure I haven't lost you.
Hey, I just advanced to option 3. Are you not seeing that on your screen?
Yeah, mine went slow. Can you go back to option 2? It's catching up now. I apologize. There we go. I'm on the right slide now. So this is for them to receive the non-covered items and pay for them out of pocket, but no claim is filed. So Medicare is not billed, no appeal. Okay. If someone wants to be able to fight for Medicare, you want option 1 and you send in the claim for them. Okay. Go ahead and go to the next slide, please, to option 3. Now this is for the patient who says, thanks for explaining all this to me, but I'm leaving. I don't have anything to do with you. I don't want this service. I don't care about it. I don't think it's valuable. I'm out of here. Which is funny to me because why do you need the form now? You're not going to send a claim to Medicare because you're not going to provide any services. You can have them fill out and sign this, but it just says, nope, no thanks. So, this is, I don't even know why I'm here. I'm out of here. I'm going. There's no care provided. There's no appeal associated. No one's getting paid for anything because no service is going to be rendered. Okay, that's option 3. Next slide, please. So if we look at the whole box, G, the different options, I want to point out there in bold that says check only one box. We cannot choose a box for you. It's important for you to know the beneficiary has to choose only one of the 3 options. They can't check 2 of them. And the notifier, which is the provider, that's you, must not decide for the beneficiary which of the 3 checkboxes to select. You can't tell them to check option 2 because that's the one that's most convenient for you. They have to choose it of their own free will. And so it's important for you to respect that and make sure that they would never report that you forced them to pick a certain option. You had it pre-selected for them. It needs to be chosen by them. And of course, the blank D has to include what the service is. So we could say chiropractic manipulation, which, by the way, is really hard to fit in that space. With a 12-point font, even a 10-point font doesn't fit there very well. So cram it in as best you can or let it overlap a little bit. Next slide, please. So at the bottom of the form now, we're looking at the last third of the form. You'll notice in the bottom left corner, it has a newer expiration date. Okay, it says 6/30 of 2023. At that time, they will issue a new form. They'll review it, they'll approve a new one, and you'll have to start using a new form in 2023. Okay, but blank H there that we have highlighted at the top, blank H is for additional information. You can put whatever you want in there. You can put a little love note to the patient, to the beneficiary, to say whatever you want. But this is a great place to add clarification that you think will be helpful to the beneficiary. If you are a non-par provider, the instructions tell us to strike the last sentence of option 1 and then add this paragraph, okay, and put it here under additional information. So you can pre-print these. If you're a non-par provider, you can pre-print these forms with that paragraph pasted into additional information. You can put a line through the last line of option 1 in section G, and that way the claim will properly be passed on to Medicaid. I'm sorry, not to Medicaid, but as a non-par provider, it'll allow you to collect appropriately. And so that's the instructions we've been given. If you want more on that, again, you can look up the official instructions, but that paragraph I put there is straight out of there, copy pasted in here. Okay, so you strike the last sentence of option 1, add this in here into the blank H for additional information, and you should be good to go. Okay, next slide, please. The last thing on the form to fill out is I and J. This is where the patient signs and dates the form. They have to sign the notice to indicate that they've received it. If you don't have them sign it, it's not valid. It doesn't count. The beneficiary has to write the date that they signed the ABN. You can't complete this in advance. It has to be done real time after the patient has had time to review and look through that form and see what their options are to understand the services and the cost. Okay. Otherwise, the ABN is not valid and you cannot collect from anybody. Okay. So next slide. So let's shift gears here a little bit and talk about how this is going to go out on your claims and what it means and when you should decide when care is not medically necessary so you can use the ABN. There are 4 modifiers that chiropractors will use commonly that have to do with the ABN form or that relate to it. Actually, well, yeah. So the first one is the AT modifier. And if you've been billing Medicare for chiropractic for more than 10 minutes, you know this, you've heard of this. By attaching an AT modifier to one of the CMT codes, 98940, 98941, or 98942, you are saying this care is medically necessary. And if you came in and audited my records, you'd see that. I know it's medically necessary. I know I'm following all the Medicare's guidelines. I put on the AT modifier to say, I know all the Medicare rules and I'm following them for this service and it should be payable, okay? Now, if you feel it's not payable and you expect the service to be denied probably because it's maintenance care, then you would issue the ABN to the patient, they would sign it, and you would attach the GA modifier. This is only if they choose option 1. If you remember, option 1 says, I want you to file a claim so that I can get the denial and fight it if I want. That's when you would send in 98940-GA, okay? My good friend, Kathy Mills-Chang says GA means got ABN, and that's how you can remember what the GA stands for, got an ABN. It means you have an ABN filled out, it's on file, it's there, and the patient checked option 1, which means they want you to send in a claim. If they check option 2, you don't have to put a modifier in there because you don't have to send in a claim. I mean, you still could, I guess, but it's internal. There's no claim going out if they picked option 2. And if they picked option 3, they're not receiving the service, so there's no modifier on anything. GZ is a modifier that says, look, I know we should have gotten ABN, but I forgot, okay? You knew it was maintenance care, but you never had them fill out the ABN. So again, Kathy Mills-Chang says, GZ means, geez, I forgot the ABN. I think that's a good way to remember. I don't think you should ever send a claim with GZ on it because that means you're saying you're dumb and you've forgotten. And there are a few other special circumstances where like you thought the service would be covered, but you changed your mind. I mean, I guess, but for the most part, I would say don't use the GZ because it sort of is a red flag saying I didn't follow the rules. I didn't fill out the ABN when I should have. The GA and the GZ and the AT modifier are only for the CMT codes because they're for covered services, okay? You cannot attach these modifiers to any other codes if you want to send them through Medicare. Okay, next slide, please. 2 more modifiers to show you, GX and GY. The GX is for all the other codes you might bill to Medicare, okay? Anything other than the CMT codes. If you want to do a voluntary ABN and say, look, we're going to provide an X-ray, it's $150, sign here that you understand that. You could, and you bill that X-ray on a claim that goes to Medicare, you would attach the GX modifier to let Medicare know that you had the patient sign an ABN, not sign it because you can't sign a voluntary ABN, but they saw an ABN and they reviewed it and the GX tells them that that's been done. The GY modifier has nothing to do with the ABN form actually, but you may put it on, if you did use the ABN, you can do GX and GY. It's for all non-covered services. So the GY would never go on the CMT codes, 98940, 1, and 2, but it would go on anything else you decide to bill through Medicare, okay? Basically, Medicare is going to deny whatever you bill that's not CMT codes if you're a chiropractor, but if you want to deny it faster and have a proper denial that says patient is responsible for this, then I attach the GY to all the codes you bill that are not CMT codes, okay? And if you also give the voluntary ABN, add the GX. Next slide, please. So excluded services are the beneficiary's responsibility by default. You can bill the patient and not bill Medicare for those things. And I put a list of examples here. So if you wish to bill it through Medicare to get a denial, or if they have a secondary policy, you can go ahead and do so. But there's no reason to bill acupuncture through Medicare or office visits or x-rays or any of that because you're not required to do so. You're only required to submit a claim to Medicare for covered services, ones that are not excluded, and that's your CMT codes, chiropractic manipulative treatment. Okay, next slide, please. So when do we use the ABN? We use it when the care we're providing, the chiropractic manipulation, is not medically necessary. The official definition of medical necessity is it is care that improves the function of a malformed body member. And in the chiropractic record, things that I like to see that prove medical necessity are the use of outcome assessment tools, or OATs, having really effective treatment goals, documenting appropriately with PART to prove that there was a subluxation. PART is Medicare's physical exam that proves a subluxation exists. If those things are there, those are great ways to help establish medical necessity when billing to Medicare. Next slide, please. Some Medicare contractors have said very explicitly, things like strains and sprains, nerve pain, functional mechanical disabilities of the spine are great things to justify chiropractic manipulative treatment. And so you have a patient who comes in and their complaint is, I can't sleep, doc. I just wake all night, and I've heard that chiropractic can affect that. That's terrific for you and the patient, but that's not a reason that Medicare is going to recognize for providing chiropractic care. Typically, it's got to be problems with the spine, and the patient has to have a complaint in that area, and you have to show that the care to that area is going to help it improve. Okay. In fact, let me expand upon that a little bit. Next slide. There's what Medicare considers active treatment is when they have a health problem, which is a neuromusculoskeletal condition that needs treatment. And the manipulation you provide has to have a direct relationship to their condition. So again, if someone's sleeping and you adjust their neck, they have sleep problems, that direct link isn't abundantly clear to Medicare, and they're not going to recognize the need for care for that particular problem or complaint. In order for Medicare to pay, you have to be able to show that you expect the patient's function to improve somehow. Their ADLs, their ability to do stuff needs to be improving in order for the care to be active treatment, which is medically necessary. And if there is an improvement in function, that's when we're going to switch and give an ABN form and choose whether or not we're going to submit a claim with a GA or not submit a claim and just bill the patient. They pay out of pocket. Next slide, please. So in the Medicare guidelines, there are 2 types of subluxations. They call them acute and chronic. An acute subluxation is when someone's being treated for something like a new injury, and you can identify it through an x-ray or physical exam, which is the acronym PART or PART. The result of the chiropractic care that's given for an acute subluxation should be an improvement in or arrestment of progression of their condition, meaning something was broken and you're fixing it and it's going to be better when you're done. That's acute, okay? But if we go to the next slide, we see what a chronic subluxation is. This is a condition that's not expected to significantly improve or be resolved with further treatment, but where continued therapy might result in some functional improvement. So the condition is staying. That's chronic, but their function might respond to care. Therefore, Medicare does pay for chronic subluxations as long as you can show functional improvement, even if the condition itself isn't being resolved. Okay? If their clinical status has remained stable, meaning there's no more clinical improvements, then it's maintenance therapy. And maintenance therapy, you got to issue an ABN and then decide if you're going to send a claim or not, based upon what option the patient chooses. Okay, and this is all from the MLN Matters SC 1101. You can Google that and get that. It's a great document to give you a good synopsis of how Medicare views chiropractic, and it's straight to the point, really. It's a good reference for you to look at if you want to learn a little more about this. So next slide. If it's not acute or chronic, then it's maintenance. Okay, so, but first here's an example. Like, I think this would qualify for payment by Medicare for chiropractic care. You got a 300-year-old woman with a chronic low back problem and stage 3 degenerative disc disease. So your primary diagnosis could be the subluxation or the segmental dysfunction in the lumbar spine. And the secondary would be M5136, which is degenerative disc disease in the lumbar region. So let's say the patient was treated and they came back 5 or 6 weeks later and they say, I can't stand for 15 minutes without pain. So they didn't have an exacerbation. They didn't have an injury. There's no acute problem per se, but I just kind of gradually, I can't stand for 15 minutes without pain. Just a gradual onset. This is chronic. If your treatment goal is functional improvement, say I want to treat them until they can stand for an hour without pain, but I'm not going to change their degeneration. It's permanent. That's an example of a chronic case where I think you don't have to do an ABN and you can get paid for this service as long as you can show improvements and movement towards accomplishing this goal and getting the patient to be able to stand for an hour instead of just 15 minutes. And if you ever reach a point where you're treating them for several weeks and they're not making progress and they hit 30 minutes or 45 and they can't get any further, then you see that over a couple of visits. Say, sorry, this is now maintenance care. I can't accomplish the goal I thought I could. Okay, so that's what I believe is covered chronic care. The difference with that and maintenance care is that there is no improvement. They've reached a point where they're no longer changing. So next slide, please. I just want to talk a little bit more about maintenance, and then we'll bring this to a close. The official definition of maintenance care by Medicare is services that prevent disease, promote health, prolong or enhance the quality of life, or maintain or prevent the deterioration of a chronic condition, which is supportive care. Okay, so if I say the purpose is to keep them from getting worse degeneration, that's not chronic care. That's maintenance care or supportive care, and it's not covered. Medicare won't pay for that. If you believe that further clinical improvement can't be reasonably expected from more care, then it's maintenance. Okay. If the treatment is supportive rather than corrective, you're not correcting something, you're not going to see a physical change, then it's as needed. That's maintenance care, and Medicare does not pay for that type of care. Next slide. So Medicare requires that you submit claims for covered services. So if you provide 9940, you adjust 1 or 2 regions on a patient, whether it's maintenance care or not, because it's a covered service, that code is covered, you have to submit the claim to Medicare. If it's maintenance care, however, then you should have the patient fill out the ABN and you should attach the GA modifier if they select option 1 and send the claim. If it's active treatment and you don't think it's maintenance care, then you attach the AT modifier. You don't worry about the ABN. You worry about the ABN at the point where you feel it may be considered maintenance. And that's how you use those 2 modifiers, the AT or the GA. By the way, there was a deal in the past where you could do both modifiers, AT and GA. Maybe when you have seen a patient where one of the contractors said, hey, we think that this code is worth about 12 visits, and you treat them on 13th visit, you could say, I believe it's active treatment, but you might be considered maintenance care. So you do both. Pretty much, I believe all Medicare contractors now say, no, you can't use the AT and the GA together. It's one or the other. Either it's active treatment or it's not. I found a diagnosis code you might want to use for patients when you're doing maintenance care, though. It explains that you're not trying to get the patient to improve some specific health state, just their function, or just to help them live better. So if it's maintenance care, get the ABN filled out. If they choose option 1, use the GA modifier. Okay. So next slide, please. So I don't know how well you can see this, but I want to show you an entire ABN form that I filled out. I actually missed a couple things here, but notice at the top, I've got the name of my clinic and my address and my phone number. And then I've got the patient's name there with the middle initial. I've got an identification number. This patient's ID number is 3. So I kept it at that. And then notice I filled in the blanks for D and I squeezed it in there, chiropractic manipulation. I had to do a tiny font to fit it in there. But in the larger space for D, it says chiropractic manipulation for maintenance because I have more room there. And the reason Medicare may not pay, I put Medicare doesn't pay for chiropractic manipulation, is considered maintenance care. Okay. And I said it's going to cost $45 per visit. As long as I'm within $100 or 25%, I should be okay with that estimate. It might have been helpful to put in how often or how long I think it's going to happen. So $45 per visit, and we're going to recommend maintenance care of once a month. So I could put that in there. When you get down to G for the options, again, I filled in all the blanks D. This is chiropractic manipulation. I forgot to check one of these though. So again, if the patient checked option 1, then I would have to send the claim to Medicare and attach the GA modifier. If they checked option 2, I would attach the GA modifier, I guess, if I want, but I'm not going to bill it out on a claim, so it doesn't matter. It's whatever I put in my own books internally. And if the patient picked option 3, it means they decided they don't want the service because they don't want to pay for it, and you send them out the door. The signature at the bottom shouldn't have been mine. It was just that's what I had access to when I threw this together. So it should be the patient's signature, right? Which is J.R.R. Tolkien. But I just signed it because it was easy to do. And then a date. I dated it today, and that shows that this patient, who happens to have my signature and his name J.R.R. Tolkien, is okay with this, and I can now, as a provider, collect from the patient that amount and send the claim or not, depending on which option they chose. Okay, so that's an example of a completed current ABN form. I anticipate some questions may be coming in, so hit that last slide for me, Christy, and we'll see how it goes. I just want to throw out one more time. There's my email address if you have further questions. I would love to show any of you paid EC chiropractic EHR software if you're in the market for that. But other questions you have from this event, feel free to reach out to me for that as well. So back to you.
Now we have a couple of questions. A few.
Okay.
Let me get to them. Oh, this was a great one. For all the ABNs that were already signed and on file, should we have the patient sign the new one, or will they remain valid until they expire?
You know what? I'm ashamed to say that I don't recall reading that specific guidance as I prepared for this, and I am unsure. So I'm going to guess and say that they're still valid if they were signed for a year. But as soon as you issue a new one, you need to use the new form. I'm pretty confident that's probably correct. I'm like 85% there, that you can keep that old form on file for up to a year as long as it was done before it expired. You're good to go. How's that for confidence?
And I'm just, right, which is funny because when that question popped up, I was like, wow, I hadn't even thought about that. And that was a great question. So just to clarify, if we are doing a service such as the 99203 exam, we are supposed to have an ABN form?
A 99203 for an exam is a statutorily excluded service for chiropractors to Medicare. You are not required to have an ABN for that. If you do, it's called a voluntary ABN. And a voluntary ABN, I don't think is the best way to go. I think you should just have your own form that says, hey, if you're a Medicare patient, it doesn't pay for exams, so sign here that you understand that and you're going to pay for it. You're not required to issue an ABN for non-covered services.
True story. I know so many practices that have a form that lists all the statutorily non-covered services, basically everything but the chiropractic manipulation, that they have patients sign instead of the ABN form, because it is super confusing for them and for your staff. And that question came up a lot. So type them up on a form and have them sign that they understand that those are not covered by Medicare. So yes, just to be clear, ABN is only used for CMT services, and we collective services denied for CMT.
That's correct. You're saying that the ABN is only for CMT services, and it allows you to collect directly from the patient once they've signed it.
We're going to get up to all these discounting questions in a minute. Let's get back to that. Let's see. If we have two different doctors that they may be adjusted by, do we need to put both docs, or can we put the clinic name under notifier?
It's the name of the provider. So I'm going to say it's going to be based upon your MPI number. It's going to be the MPI number of the person who's providing, if it's an entity or an individual, you would use whichever one you're billing with. That would be my my best guess there. I apologize for guessing, but sometimes that's what it comes down to. And if any of you really want to, my email address is on I'll find the official. If the things I'm saying I'm not totally sure of, feel free to email me and I'll find you the official once I have a little more time to dig.
Let's see. So if a patient has Medicare and we know a service is not covered and they are self-paying, do we have to have them do the ABN with option 2? Is it mandatory for Medicare patients?
You can't have them do anything. They choose whichever one fits their needs. So if they pick option 2, that's their choice. It's mandatory for someone with Medicare Part B who is receiving chiropractic manipulation and you think it's not going to be paid. So, and then they choose whichever option they want. Did that answer the question, or?
Yeah, you did. Or if didn't, Jen, just retype that at the top of the screen if we both misunderstood that. But in the D space, do you have to write chiropractic manipulative service, or can you put in the code 989404142?
Well, the patient has to be able to understand it. And if a patient says, I don't know what 98941 is, then I would say more. You saw the sample form I did if you want to go back one slide, I crammed in chiropractic manipulation. It had to be, the font had to be really tiny, or you could handwrite it. But if whatever it is that requires the patient can say, yes, I understand what the service is, then that's fine. I suppose you could put the 98940, and then in the bigger space for D, you could write it out there. And hopefully the patients are smart enough to understand that's what it means.
Do patients need to sign a new ABN anytime care changes, a patient going from maintenance to active care and vice versa?
Well, a patient going from maintenance to active care, they don't need an ABN, right? Because they had one for the maintenance care. And now you're starting active treatment. You treat them for a month or something. And then they shift back to maintenance care at the end of that month and they want to go back to that. Then you issue a new ABN. The old one is no longer valid because they started a new episode of care. So you would do it at the end of any episode of care when you transition back to maintenance. Okay, so patients might have 3 ABNs throughout a year if they had 3 treatment episodes that were active and then switch back to maintenance 3 times. Okay, so even though the ABN form is good for up to a year, it can be interrupted by active treatment, and then you would issue a new one and have them sign an updated one.
Okay, so somebody basically just asked the very same question. It was very, they wanted to know if they had to void the ABN if the patient went back into active treatment. It automatically becomes void, or do they need to write void on it, or?
There's no instructions I'm aware of that says you have to do anything with it. It just ceases to be in effect any longer because they're under an active treatment course of care.
And I've never had that question asked either. Y'all are asking such amazing questions today. And then to answer your question, yes, if they go from maintenance to active care, yes, that means that ABN becomes void. But if they go back into maintenance, yes, they need to sign a new ABN. It does not, the old one does not go into effect at all.
That's right.
Okay. So if it is a non-covered service and we know it, do we still have to bill it? We don't have to do it in ABN, but the GY modifier confuses me, making me think we may have to bill the service.
Okay, so the GY modifier means if you want to bill the service, you can bill it through Medicare. So let's say you do an X-ray. Let's do 72100, which is lumbar X-ray series. If you want to, you can just have the patient pay you for that and record in your billing system that you did that. But you can also send it through Medicare if the patient doesn't believe you that it's not covered or something, or if you want to send it through because that'll help with a secondary payer or something, then you can send it through with a GY. Any other code you put on a claim form for Medicare besides those 3 CMT codes should have the GY on it, but you do not have to bill Medicare through Medicare for any other service besides chiropractic manipulative treatment. It just depends on if the patient wants you to, or if you have a secondary who needs to see a denial in order to pick it up.
Okay, and somebody wanted to clarify, you should not bill out an AT-GA modifier together, correct?
That's correct. It used to be okay. There were some guidelines years ago, but I'm pretty sure they've all wiped them out now and said don't do those together. It's one or the other.
Okay, do you need a GA and GY on the non-covered services or just GY?
Okay, GA is only for chiropractic manipulation. It's the only one that can get that when they fill out the ABN. GY is only for everything else. So you never use those together. GA is for chiropractic manipulation with an ABN, option 1. GY is for anything else you bill through. You could do GX and GY, and I think I saw a question along those lines. That would be if I gave them x-rays and I had them fill out a voluntary ABN that said, hey, we don't, x-rays aren't covered. So the GX would, it's just informational. It's just telling Medicare I had them do a voluntary ABN. It doesn't really make a difference. It's just information. The GY, though, does make a difference. It makes Medicare deny it and say patient responsible. So you could do GX and GY together, but for non-covered services, not CMT codes. I hope that makes sense.
I am a non-participating provider. We only accept Medicare age patients with supplemental care and bill that carrier. We never bill Medicare directly. What are your thoughts?
Wait, so start that again. Why do they never bill Medicare?
They only accept Medicare age patients with supplemental care and bill that carrier and not Medicare.
I'm not sure if I understand. They only bill patients who are...
Okay, so what I'm going to tell this person is, if you will provide more detail and email that to Evan, his email address is on the screen, because I feel like that one is probably going to be a much more in-depth.
So one of the rules says if you routinely give an ABN to everybody who comes into your office because you only provide maintenance care, Medicare gets suspicious. They said you can't do the ABN for everybody. Odds are some of your patients should have Medicare cover some of their services because they satisfy the criteria. And you can't just say, well, but I don't document well enough. So therefore, I know it's going to be denied because my documentation, that's not an acceptable reason. And Medicare can get on your case for that. So they expect to see some patients have active treatment and some don't.
Okay. So, and just to be clear, because I see this question coming up multiple times, if a patient goes from maintenance care to active care and then back to maintenance care, each time they go to maintenance care, if it's like every other month, you have to have a new ABN signed every time they switch from active to maintenance. Just because they signed one in January does not mean that it remains active until December. The minute they go from maintenance to active care, that previous ABN is null and void and will need a new one upon entering maintenance care again.
So they can make an informed decision based upon what they've been through with the current episode, not... So that form is no good. It pertained to something in the past. You got to do a new one saying, well, here's what's happening now after we complete an episode of care that was covered.
So, here's another good one. It said, when using a modifier GY for non-covered services, are we now not to use that modifier, but instead use modifier GX when we are submitting a claim to a major medical secondary policy?
A major medical secondary policy, it probably doesn't care about any of those modifiers unless they have their own special rules. Those are Medicare modifiers. You should only use them to bill them through Medicare. A secondary, you'll have to check with their rules and regs, but generally they would say those are Medicare modifiers. We don't care. Or they'll say, we want you to use Medicare modifiers. You just have to go payer by payer on that one. But by default would be no, they don't need the modifier at that point. That's my default.
There's no rule that says anybody specifically has to explain the ABN form in the office to the patient, just that somebody that works at the office explain the ABN form to the patient.
I'm not aware of a rule that says who has to do it. It doesn't say that it must be the doctor or the front desk or anything. I'm not aware of a rule that says that.
If a patient chooses option 1 for maintenance care and we provide treatment once a month, do we need to submit to Medicare every month or just the first month of maintenance?
Every time the service is provided, you have to send a claim for each date of service, and then Medicare will deny it and the patient will pay, and that's that.
Okay. And again, ABN form is only required for chiropractic manipulative treatment. I'm like choking over that. So stem cell treatments, you don't need an ABN form for. That's not covered by Medicare.
You could do it. It would be voluntary. You could use the ABN, but I think you would do much better to make your own form and say, we do stem cell in our office, and it's really great, and here's why. And by the way, Medicare doesn't pay for stem cell. Do your own form and have them sign it so you can have on record they understand and acknowledge that.
Okay. Oh, this is a good one. So under the offices, under Section F, would you list the CHUSA fee or the practice or the office's actual fees for a service?
Whatever you want, as long as it's within $100 or 25% of the actual fee. I would go with usual and customary because I think it would give you an opportunity to then say, but look, ChiroHealthUSA is a great option. So they kind of, it leads them down that path, Here's our regular fee, it's $50. But if you're joining ChiroHealthUSA, it's only 30, 35 or whatever.
Hey, Evan, do you have an example of of a form that they could use for non-covered services? Because I'm being asked that a lot.
I think I had one at one point, but it's pretty simple. You just say, I call it non-covered services or notice of personal or patient responsibility, and say, in our office, we provide lots of great services, and a lot of these aren't going to be covered. Here's what they are. That's it. And then sign and date the bottom, have the patient sign and date. That's all it really needs to be. I don't really have an official form. There's no standard I'm aware of, although I believe that some payers do have, like I think some Blue Cross carriers may have a form I think I've seen before. I'll have to look for that. And if I come across it, we can mail it out or email it out. I'll look.
Somebody in the chat box did say that Blue Cross had a form, and that's the form they use for everybody for non-covered services.
So check it out.
Somebody said, do we have to list the services, or can we just write C form in D or E box?
You mean like how there's 7 versions of blank D, and in the bigger space you write it all out, and the other one says C box?
Yeah.
I do not believe the guidelines speak to that at all. I read them literally yesterday, and I'm pretty sure they don't specify. It is hard to fit stuff in there. So again, I guess your rule of thumb is, would a patient understand if they would get lost? That's why I'm saying don't use just a code maybe. But if you think they can understand, then that may be okay. I'm not aware of a rule that says you can't.
I would be consistent in whatever decision that you make. What you don't want to happen is in an audit situation where some of your forms say see form or see attachment and then not have the attachment in the file, and then others where you were very specific. I think consistency is of the utmost importance, because otherwise it just looks like you're trying to confuse your staff and your patients. What do you think about that, Evan?
Yeah, I agree.
So I had a couple of questions that wanted to know that, so yes, our national associations are trying to get parity for chiropractic in Medicare, and somebody was asking if we had any kind of update, and no, there is no update. I know that both ACA and ICA both post regular updates on their websites, so if you'll just follow with those. With everything with COVID, a lot of these organizations are not able to meet in person like they normally would. There's a lot of limited access to the people on Capitol Hill that would make this possible. So just be patient and just know that it's a process. But yes, that is something that is going on, but it can take a while. Do we have to explain what box G means, or do we just let them figure it out?
They can read it. The instructions are there, but if later they claim that they didn't understand or you didn't make it clear to them, all the instructions say the patients have to understand it's for informed consent, so they know they're making a good choice. So, I would do my best to explain it and instruct them to read it, just to make sure you covered all your bases. Do we need an ABN for Advantage plans? So no, the ABN is just for Medicare Part B fee for service. However, an Advantage plan might specify they want you to use the ABN, but Medicare says it's just for Medicare Part B, not Advantage plans. And if you want to so when you're billing Advantage plans, you aren't required, unless the payer says so, to do these modifiers at all or provide that information. It's just like you would treat it like any other patient with that Blue Cross. Okay, well, guys, we have gone over 10 minutes, and I have another webinar starting in 5. So I'm going to let us wrap this up. Listen, there were so many questions, and a lot of you, I tried to pick the ones that would apply because a lot of y'all were asking the same questions. But you can email Evan at evan.gwilliam@paydc.com. If you are watching this webinar recording and you type it into the chat box after I close this down, so don't type something in at the last minute thinking it's going to get emailed to Evan, because it won't. After I shut this down, it will email it to Evan later today if you are watching the recording later. And just be patient, because remember, there were like 1,200 plus people who registered for today's webinar. And so be patient when you're waiting for a reply. Y'all don't have to email me and say, I emailed Evan yesterday and he didn't respond. I'll get back to you before the end of the year for sure.
In fact, if you have gone through this process before, just know that Evan actually responds a lot faster than most other people. But that's not why he's my favorite. So, but y'all, thank y'all so much for being a part of the webinar today. I know one or two people had a couple of issues with the audio, which is crazy. But again, watch the recording. If you have any questions, submit them to the chat box. They go straight to Evan. He'll reply back to you, or you can send it to him now. You guys were amazing. I can't believe it. It's so rare that Evan and I get questions that we're like, oh, wow, nobody's ever asked that before, or I didn't think about that. So you guys were awesome.
We can find the answers, though. So bug us. We'll help you guys out all we can.
Sure will. And so reminder for next week, we have another webinar coming up. Fab's going to be here next week, and we're going to be talking about thriving in the new normal. I'm not going to, y'all already know, I told you last week I argued with him. I don't like new normal. And then we're going to take a break because it is Labor Day weekend, and you guys have earned a break more than anybody I know. And then we're going to come back and we're going to have Dr. Chris Anderson, who was the first time presenter on the webinar series, talking about HIPAA scenarios in a chiropractic office, all the things that we didn't think of that were HIPAA related. It's going to be fun, and he is super fun. That is just like the only thing worse than talking about Medicare is talking about HIPAA.
Yay.
So y'all definitely check that out. We have webinars up all the way through November. The rest of the webinar series for the rest of the year will be up on the website in the next 2 weeks. So check them out. Register early. Thank y'all so much.
Thanks, everybody.
And we'll see y'all later. Bye-bye.
Bye.